Good day everyone, and welcome to this week's lecture on quality assessment of qualitative evidence. This week we're going to be talking about what we call critical appraisal, which is the word we refer to for looking at an individual article for its strengths and weaknesses in terms of its design and methods. And this is typically undertaken within the process of quality assessment as one of the stages of the systematic review process. And the example we've chosen this week is to demonstrate that qualitative evidence isn't just in the category of nice to know if we have the time, but that it can actually inform current strategies. In this particular case, it can inform plans for quarantine in the context of the COVID-19 virus. And so we're going to walk through an example of a qualitative study to see how well it has been conducted and to see what lessons we can learn from its findings. So the first thing that you need in the process of critical appraisal as part of the quality assessment process of a systematic review, you need to identify your qualitative study. In this case, we've identified a study on the psychosocial effects of being quarantined, conducted in Toronto healthcare workers, and the next stage is to match that with a checklist, an appropriate checklist that prompts us to ask the right questions of the study. And the checklist that we have available is the Critical Appraisal Skills Program checklist, specifically with 10 questions to help you make sense of a qualitative research study. And this is typically organized in 3 sections. Are the results of the study valid? What are the results? And will the results help locally? And you may find it helpful to pause the video here and obtain copies of the 2 items before proceeding with the rest of this presentation. So the first of the questions of the CASP checklist is asking, was there a clear statement of the aims of the research? It is always a good technique with any critical appraisal of a research study to go first of all to the abstract. You can then get a helicopter view of the study as a whole, its design and methods and its main findings and conclusion. In this case, the abstract contains the objective, which is to examine the psychosocial effects on healthcare workers of being quarantined because of exposure to severe acute respiratory syndrome, SARS, a predecessor to the sort of virus that we're currently experiencing with COVID-19. The tip or technique that I often use is when looking for an aim or an objective of the research is to go just prior to the methods to the preceding sentence, or at most the preceding paragraph, and this usually states the full aims of the research using words like examine or explore or the aim is to, so we get a clear picture. So in this case, this study examines the psychosocial effects on healthcare workers who were quarantined because of exposure to SARS immediately following the lifting of infection control restrictions after the outbreak had been contained. It's just worth mentioning here that you will find with qualitative research that the context, both geographically and temporally in terms of the time, can be very important, both in terms of the point of data collection and the point of the phenomenon of interest that you're actually studying. So in this case, we judge that there is a clear statement of the aims of the research. So we mark this with a green tick to indicate yes, this criteria was fulfilled. The second question, again, is a second screening question to judge whether the article is going to sustain the appraisal process. It's asking, is a qualitative methodology appropriate? The first thing that we can establish from the title is that this is a qualitative study. We have the hint here from the checklist that says that we've got to look whether this is a study about experiences or actions, and when we look in the description of the topics covered by the interviews, we can see that they included the quarantine experience, so it ticks the experiences box, if you like. Perceptions of contracting and spreading SARS, so again it's about perceptions, and it's examining the effect of SARS on participants' work. So quite clearly the phenomenon being evaluated here is suitable for a qualitative methodology. So we already have two green ticks here to indicate fulfillment of the two screening criteria, which suggests it will be valuable to proceed to the rest of the study. Moving on to question 3, we're asked, was the research design appropriate to address the aims of the research? This question about being appropriate, and then in the hint saying whether the researcher has justified the research design, flags up a challenge of using quality assessment. We have a brief description here. The paper itself is very brief, a brief communication. So the authors describe what they're doing, but they don't specifically say why they chose the method that they used. And you will find that this is quite common in shorter qualitative papers. It doesn't necessarily mean that the authors haven't thought about their choice of design, but just that they haven't told us about their thinking. And so that's why in this case we rate this as a can't tell. So in this particular case, they've conducted semi-structured interviews. They've interviewed people by telephone with 2 interviews in person. They've audio taped the interviews and transcribed them verbatim. Our first impression would be that semi-structured individual interviews would be an appropriate way of eliciting perceptions of SARS. Certainly sensitivities around the subject, for example, about how tightly the staff observed the quarantine provisions might prevent us from expecting to see a group interview or a focus group, for example. So moving on to question 4. As with quantitative research, the sample is very important as a determinant of the research design, but we're looking for something different. We're not looking for a representative sample, we're looking for an appropriate sample. There are many alternatives open. In this particular case, though, they obtained a study sample through volunteers, so requesting study participation through posters. That raises the possibility that the people who apply to be part of this study may have particular motivations, either positive or negative motivations. And indeed, in fairness to the authors, in the limitations that accompany the abstract, they talk about the limitations that the sample is restricted to Toronto healthcare workers, and that they would only be able to elicit views from those willing to discuss their experiences. However, they couch this in terms of representativeness of the population. This is a very quantitative way of describing a sample. We're actually more interested in whether the views that we get are likely to enrich our understanding. We're not interested in generalizability, which comes from a representative sample. We're interested in transferability, which comes from the ability to transfer findings across contexts and studies. So in this particular case, we have concerns about the recruitment strategy indicated by the author's own report of their limitations, and so we indicate this with a no. Question 5, an important question about data collection. And just as we said, there's difficulties with questions that are expecting us to look for justification of what has been done. This data collection series of hints is quite lengthy, and so this by implication may set a higher threshold for quality, because more of these criteria might be required to be fulfilled in order for it to pass our assessment or verdict. So we have to be careful that we're not jeopardizing or penalizing the study for the number of criteria that we are requiring to be fulfilled in a particular subcategory. So in this case, we've already said these are very brief reports. They conducted semi-structured interviews. They audio taped the interviews and transcribed them, and they did this until a point of theme saturation. They don't provide justifications for the setting or the methods chosen. They don't tell us very much about the topic guide, either their use of it or an example of the questions in it, and they describe achievement of theme saturation but don't actually discuss it. Notwithstanding this, we can see that this particular method is appropriate in terms of how the data were collected and the methods chosen, which is why we give it a fairly generous yes rating here. Question 6 is the question that is, in my experience, most poorly fulfilled by qualitative studies from the CASP checklist. It asks whether the authors have considered the relationship between the person collecting the data and the people being studied. We have indirect detail in the sense of we have identification of who the researchers are. We can ask the question, are these people independent of the health workers being studied here, or may it well be that they have some sort of allegiance to them, and that would be a concern in this study. And we can also detect through the wording of this paragraph here from page 406 possible cause for concern about the relationship between the researchers and the participants. Rather than just stating a matter of fact that the quarantined healthcare workers expressed a wide range of emotions, including fear, lack of control, anger and frustration, they frame it as although, and therefore then go into providing a justification, saying that although they felt these feelings, they were still first and foremost dedicated professionals, and that seems to indicate an allegiance of the research team to the ones being studied. So this is quite difficult to detect, but hopefully you can see that they are going a bit further than just reporting what they found. They are trying to, if you like, justify the presence of these emotions and downplay their importance compared with an overriding duty of care. So for that reason, we have concerns about this, and we mark it as a no. Moving on to question 7, have ethical issues been taken into consideration? Many people have concerns about this sort of question because an ethics application is a plan for conducting research. It's not a guarantee that the plan has been followed in how it's been conducted. The study certainly gained ethics approval and used informed consent. But we have to be careful. Many people assess this question on a CASP checklist by simply looking for the presence of ethics approval, and that's not the same as saying have the authors thought of the ethical issues. We could reflect here that if the requirement is to follow the provisions of quarantine, then what would the research team do if the people being interviewed revealed that they had broken these provisions, so they had gone against them and perhaps jeopardized their own health, that of their families, or that of their patients? How would the researcher react? What requirement is there for disclosure? Certainly we have concerns, although not concerns that we can clearly specify about consideration of ethical issues, which is why this rates an amber under the can't tell category. And the 8th question parallels the data collection question. It's a data analysis question. The Cochrane collaboration defines qualitative research as having recognizable methods of data collection using qualitative methods and recognized methods of data analysis using qualitative methods. So you'll notice again that this is quite a long prompt list requiring a lot of fulfillment. Again, because of reporting restrictions, the amount of detail is quite perfunctory, quite limited. There is one instance where they talk about a difference of opinion, with some frontline workers feeling that management could have done more and others not feeling the same way. On the whole, this is a sound description of the method, but not a particularly rich one. So again, we give it a generous yes. There's no serious concerns from the methods as described. On the other hand, more detail would help to build up our confidence in these methods of data analysis. With regard to the findings, question 9, is there a clear statement of findings? In the abstract, it focuses around 3 major themes, although in honesty, those aren't the most interesting parts of the article. There are some specifics that are much more interesting. The arguments are presented as descriptive findings. There's little testing of these. It's a very descriptive, non-analytical presentation. They do occasionally bring in the literature from elsewhere. But it is worth bearing in mind that we're not going to be using this article in isolation, and so there will be an opportunity to look for triangulation or agreement across multiple studies. So there's a second level of validation across studies to compensate for some of the limitations of the lack of clarity within studies. So in this case, we don't feel it's a particularly strong feature of this study, and so we have rated it as a no. Finally, how valuable is the research? Well, immediately we can see how this experience from SARS may well translate to COVID-19. We see that the healthcare workers felt that although the quarantine provisions were fairly straightforward, they didn't really consider what should be done once they were in quarantine in their own home, how should they behave there? Similarly, they had anxieties about return to work which weren't addressed. So we could immediately use these findings to inform guidance or an action plan that doesn't just look at how you get people to stay at home, but looks at how you support them at home and how you manage their return to work. So valuable research, even though this is from a comparable condition, not from the actual condition of COVID-19. So what do we do having made these assessments? Well, we can summarize the assessments. Here you've got the color coding. You'll see that there are equal numbers of criteria that have been satisfied and which are unsatisfactory, and then a couple in the can't tell category in the middle. The overall assessment is that this study carries moderate risks to rigor. The important take-home message is that we're making a qualitative judgment looking at this color profile, if you like. We're not using scores. And we don't use scores for any critical appraisal. There are very good reasons for this. Two very good reasons for a start. First of all, if we were to assign 1 mark for each of these criteria, we have no reason for believing that they are actually equally important. So is ethical issues as important in the quality of a study as, for example, the recruitment strategy or the method of data collection? The alternative would be to weight these criteria, giving more marks to things that we felt were more important. But again, we have no empirical basis for assigning those marks, so any weighting would be flawed. So what we tend to do is create an evidence profile similar to a risk of bias profile for Cochrane with this color coding. Of course, we've only looked at an individual study. The value of these qualitative studies is increased further by placing them alongside other similar studies. This rapid review actually reviews qualitative studies together with other study types like cross-sectional studies. That increases the confidence in the key messages that are highlighted on the left-hand side here. We can see our individual study is placed alongside 24 other studies. And the concerns that we have, how do you manage the individuals in terms of instructions for when they're at home and manage their return to work, could inform some guidance that would complement some of the more quantitative work. So in terms of an exercise, what are our take-home messages? Well, we've seen some of the limitations of quality assessment checklists. We've seen that some of the criteria require justification, which places a requirement for more detailed reporting, which may not be possible within the confines of the word limits for an article. We've seen other criteria made up of multiple hints, which may unwittingly raise the bar for quality, because we may feel that all of these criteria need to be fulfilled. But above all, we must avoid what David Sackett described as critical appraisal nihilism, this idea that no research study will be good enough on which to base our decisions or judgments. We've seen that even a qualitative study that lacks some of this important detail may supply us with useful interpretation to help us in our rounded out decision making. We've also seen that qualitative studies can contribute at both a conceptual level, so it can come up with ideas of what may be important, but also at an instrumental level, it can embody practical wisdom, like, for example, the need to manage the return to work. Importantly, we've seen that quality assessment is a journey, not a destination. So we could spend a lot more time on making the assessment. We could no doubt identify other things to record and to discuss. But the structured way of exploring a study is in itself a useful process. We've also seen that we wouldn't judge an individual study in its own right, but would look at its overall contribution within the totality of the evidence base, which is where systematic reviews of qualitative research come in, otherwise known as qualitative evidence syntheses. And finally, we've got the very important message that the overall assessment of quality is a qualitative assessment, and we should never resort to scoring. So thank you for your attention. I hope you found the little tutorial here interesting and useful, and hopefully it's also illustrated the topicality and value of qualitative research in a time of public health crisis. Thank you.